Welcome to my show. I'm a guest here, and his name is Brian Townsend. Mr. Brian, how are you doing, sir?
I'm doing well. Thank you for having me on.
Thank you so much for the opportunity, Mr. Brian. Firstly, you are a national speaker. You are also a trainer and a leadership consultant. Can you please, Mr. Brian, discuss more about yourself and how you are doing currently now, Mr. Brian?
Yeah, I spent 28 years in law enforcement. I was a police officer in the state of Missouri, city of Joplin, Missouri. A great job. I loved the department, the people, but my dream was the U.S. Drug Enforcement Administration, the DEA. So in 1999, I began my DEA career, which was 23 years long. My DEA career was started in Little Rock, Arkansas, and then I went to Southwest Texas, and then I went to Virginia to our training academy. And then my last 2 years, I was back in Springfield, Missouri, where I was the what they call the resident agent in charge. I was in charge of the Springfield, Missouri office and the DEA operations in 25 counties in Southwest Missouri. So I retired in 2022, opened my own training and consulting business. I also went to that's called Eagle Six Training. I also went to work for a intelligence center called the Mid-States Organized Crime Information Center, where I coordinate and put on training for law enforcement in 9 states. And then I also started a nonprofit organization to spread awareness of the illicit fentanyl crisis and other emerging drug threats. So,
Hmm. That is definitely very beautiful. That means your journey was just from states to states to states to state. Then you actually retire. Then you are starting your own consulting business. It's very, very beautiful. Thank you so much for those insights. And from the experience, from the traveling and the experience you've had, have you written any book or are you planning to write any book in the coming future, Mr. Brian?
I have slowly been writing a leadership book. I have some very basic leadership principles, um, and I am slowly don't look on the shelves anytime soon. Maybe it never gets done, but I have been slowly trying to put my thoughts to paper, and I'm probably 15 pages in, which is 14 more than I thought I could do. So
Thank you so much for that insight. We definitely hope you are able, if possible, you're able to definitely write the book. Thank you so much for those insights. I would like to dive to the point of opiate and fentanyl. We do know that there are a lot of, during the historic time, there are a lot of, type of illegal drug and stuff like that during the historic time. But I just do not know, but with time, it definitely upgrades. Like it's just getting more worse and worse and even more worse and due to the point of this opioid and fentanyl. So I would like to ask, how should you think leaders in healthcare, in education, and also government also be approaching the opioid fentanyl crisis differently, Mr. Brian?
yeah, so the different perspectives are definitely appreciated. Having different people in the room and from the different sectors to combat this from different angles is important. I think for law enforcement, the leadership needs to have a strategic approach. It's focused, laser focused on the problem and how we're gonna solve this. One thing I've seen from sometimes at the local levels, this happened actually recently. I was talking to some narcotics agents and they were talking about how, they've had an increase in overdose deaths and then I could hear them talking about their cases and they're talking about, methamphetamine and cocaine and other drugs and by all means, I understand those are important investigations as well, but if the problem is overdose deaths because of fentanyl, then that's where the strategic efforts need to be is working these investigations that target these fentanyl dealers that are killing people, right? So that we need to be focused, we need to be laser focused on what the problem is, understand what the threat is, and how we're gonna solve it. Healthcare. I think there needs to be a discussion on a few things there. I think there needs to be a discussion on pain management. Pain management in the United States is different than any other country in the world. Why do we treat pain differently than any other country of the world? I mean, so you just look at the number of people that use legal opioid prescriptions. It's much higher. I think right now it's approximately 36 or 37 prescriptions per 100 people in this country. Uh, it's ridiculous, and and that's come down quite a bit from its high in 2012. But I think we need to talk about how we look at pain management and just the whole pharmaceutical industry in general. Um, I think that's a concern. Education, I think the leadership there needs to focus on giving our children much needed information. So many people, so many parents are not having these conversations with their kids, and they're going to have this conversation one way or another, whether it's from drug traffickers or from social media. They're going to learn about these things, and why not give them accurate information, so that way they're armed with the facts, and when they're faced with these very difficult decisions, they they know how to respond, or at least they have the information to appropriately respond. Um, and I think overall, I think we need to have all kinds of conversations: mental illness, trauma, the stigma of people that are suffering from substance use disorder, addiction. I was just talking to someone a few days ago, and someone nationally known, and just absolutely cruel the way he treats talks about people who struggle from this, calling them cowards, calling them addicts. It's someone who just doesn't understand addiction and understand what it does to the brain for so many people. And so again, I think there's so many different angles we have to attack this crisis from, and put different perspectives in the room, and come up with reasonable and actionable solutions, and also fund it because we don't we can politicians will tell you they don't have the money, or they can't find the money, and that's just, it's ridiculous. They find it for other sources. Let's put the money on this problem on the front end, and on the back end. It's gonna help people, one, and number two is it's actually going to decrease so many other things that we're constantly funding, like crime and all the collateral damage because of drugs. Let's take care of it on the front end, and we'll make a big difference on the back end.
Yes, definitely agree with you, Mr. Brian. Honestly speaking, it's definitely not easy. The truth is very bitter, Mr. Brian. For us to know that these things really kill people, it has taken a lot of people's life. And we just need to try our best to educate and also have some kind of leadership that could control this type of things. And as you said, mental health, anxiety, just make people to get more educated in this area, and to make them understand this thing actually kills. It actually kills a lot of things within someone else. It's very, very important. And I also like to dive to workplace leaders. How you think leaders can also try their best to also recognize this thing within their workplace, and also try their best to just try their best to do it without shame or fear. So how do you think workplace leader can be trained to recognize these signs of substance abuse without creating this kind of fear or shame, Mr. Brian?
I think we need to talk about just having some compassion, some decency towards each other. It's just empathy. It doesn't mean you agree with their behavior. It doesn't mean that you will reward or applaud their behavior. Not at all. And it doesn't mean there shouldn't be consequences for breaking the law or doing, negative things. But having a little empathy, having a little understanding, don't come across as just, this person is a addict, quote unquote, or a junkie, or these terms we use that just they come into the conversation confrontational, right? It's so just coming to listen, coming to learn, not agree. I don't applaud people for using drugs, but I want to understand what's going on and how I can help this person, and let them know that we're here to help, and we want to provide the resources to help. I think that makes a big difference. And if they can, the leaders in organizations can set that tone and develop that type of culture, then that's a great thing, because what you're telling people is that I care about you, and that you're struggling, and I want to do what I can to help you. I'm not saying I agree with your behavior, and you made some bad choices, but let's figure this out, and let's get you through this. Just being a human being, just being a decent person. It's not hard to do.
Definitely agree with you, Mr. Brian. And you and I have to agree that in our time now, we are lacking such situation. You and I will agree that during that time, during those historic time, there's still some kind of empathy, compassion, love, care towards one another. But during this time now, we are lacking it. And this is one of the issues causing. Because when we see our fellow friend or we see our fellow colleague having such situation, we need to show the kind of care, kind of support that could definitely help that person in a very long time, honestly speaking. So it is very, very one of a very big tool. We need to show the care towards each other and also know how we could build relationship and know how we could correct ourselves when things are not going in the way it should go. Honestly speaking, it really, really helps. And I also like to dive to systems, if there is any in our time currently, if there is any system you think should be in place within organization or even probably public agencies. So what system should you think could should probably be in place within companies or those leaders that could implement in our companies or public agency to support employees or clients struggling with this opioid misuse or also drugs use, Mr. Brian?
Maybe some type of employee assistance program where they can seek help for various reasons. Maybe they're using drugs or alcohol because of abuse. Maybe there's some sexual or mental or physical abuse. What kind of resources are we going to provide them to cope with those things? Maybe there's some trauma as a result of that. Maybe there's some mental illness. I mean, just if someone struggles with those things, we want to help them, right? But some people think because some of those folks turn to drugs or alcohol as their coping mechanism, again, which I don't agree with, but they do. Then all of a sudden they're dead to us, right? We can't help them, and that's just a silly way of thinking, and it's an impassionate way of thinking, and so I think the systems would be just where organizations provided some type of opportunity for employees who are struggling with various things to seek help, and to be able to obtain that help, whether it's medical related or however, but just have that avenue where they can do it. And I think that speaks volumes about the organizations that make those things available and encourage employees to utilize those services if needed, because you're telling your employees, I care about you. I want to see you get better, and I think that's a beautiful thing. And ultimately, I think those employees are going to appreciate that. I think they're going to work harder in those organizations and be more loyal, and that's a win-win for everyone.
Completely agree with you, Mr. Brian. Honestly speaking, that's definitely a win-win. When someone shows us empathy and care, as I said earlier, it will definitely work in a very, very long way. And implementing those features during the organization will definitely help those that are struggling with such situations. And that is where I want to also dive with compassion and accountability, Mr. Brian. Leaders have to have, there are some features a leaders have to have with this type of situation you are saying now. A leader has to know how to manage it and also know how to show this accountability and compassion. How do you think leaders should balance compassion and accountability when dealing with opioid crisis in their organization or region, Mr. Brian?
I think all managers and leaders need to make their vision clear and build a culture of uh, trust and safe environments. I think we call it like psychological safety. Where people can thrive, where people feel safe, where people can fail, but fail forward. Whereas uh, where we can learn from those things. Where people can laugh, where people can go to their coworkers and colleagues and ask for help. Whether it's with an assignment or whether it's just life related, right? Just if they can encourage those types of cultures, research is clear on this. Those folks do well. I mean, they're more loyal, they stay longer. I mean, all the negative metrics, less sick leave, less annual leave, less employee theft, less complaints. I mean, like it's clear as mud. It really is. The better the environment is, the more we're going to thrive. I don't care if that's a school. I don't care if that's a work. I mean, it's just the reality of it. If you um, and I think that's the type of cultures that managers and leaders should thrive for. It just makes sense, common sense.
Yeah, as you said, common sense. Just try to give that sign of opening up towards the organization. When showing that kind of opening up and showing, you're free to be here, you're free to be, those type of things definitely improve and help such person. And showing that kind of, friendship and everything towards the organization and not a sign of people, avoiding or stuff like that will definitely help in a very, very long way. Mr. Brian, thank you so much for that insight, Mr. Brian. And lastly, Mr. Brian, if there is any piece of advice you would like to give to leaders who feel overwhelmed, some leaders currently now, they could be feeling overwhelmed with this crisis that's happening currently. So, what's one piece of advice do you think you can give to leaders who probably feel overwhelmed by the by the complexity of this crisis, Mr. Brian?
I think understanding that you're not alone, there's a lot of folks who are struggling with this. Try to, if you can, try to put yourself in that person's position, uh, and just try to have a little more empathy and understanding. And I need to say it again. It doesn't mean you agree with negative behavior. It doesn't mean that you celebrate it. It just means that you care about this person as a human being, and that you want to see them get better. You want to see them succeed. I think if we just make that conscious effort to be human, and I know it sounds weird just saying that, but to be human, but think of how, I don't care if it's drugs, I don't care what it is. I mean, just be a decent person and the world would be better.
It will be better for every single one of us. And we have to also know that drugs definitely do not solve issues. It definitely not solve issues. It definitely not create. It's even hard to the problem because it gets to a point one cannot even definitely solve the situation. It has to be problem. But when a situation comes, and that's what we have to understand in this life that we are, Mr. Brian. Life happens. Everything cannot be going smooth in life. It is not possible. But when life happens, to now probably look for drugs or stuff like that to probably balance things is not really the right choice because there is no person in this life. Life do happens to people, and that is how this life is programmed. I think that is how it is programmed. Life will happen. Well, that is the time one have to show this kind of kindness, humility, and show this kind of just out of kindness to just relieve those situations because it will come, but it is not for life though. It's just for the main time, for that time. So that is definitely. But using such medicine is not definitely helpful. And as you said earlier, as a leader, it is very important to have this kind of kindness and care. As you said earlier, not to encourage them, but definitely to let them know that we care. We do know you're facing this thing, and I want you to be better. I want you to recover from this pressure or this kind of thing you are using. Showing that thing definitely, I have to be honest with you, Mr. Brian, it could change someone's life definitely. Because as a leader, there's a sense of influence. That influence is there. And if that influence works well, showing that kind of kindness definitely could change a lot of people and they will definitely forever remember such person. And lastly, Mr. Brian, there's a question I normally ask during the end of the show. From the forefathers, there are a lot of beautiful things that do exist during our forefathers' time that is missing in our time today, Mr. Brian. If there is anyone or anything you would like to bring back to our time today, Mr. Brian, what do you think that thing will be, Mr. Brian?
Well, to go along with what we've been really talking about is just building relationships. It's I know we all are on social media and all the high tech stuff, and I get it. I use that stuff as well, but I think our young folks are growing up without this, without these conversations. They're doing it with their thumbs and their fingers, and again, I text people as well. I get it, but there's a loss of something when you don't have that face-to-face conversation. And I'm sure that if you and I talked for 5 more hours, I'm sure we'd disagree on some things. you know, doesn't mean that you're going to hate me or I'm going to hate you, right? I mean, just means we have different opinions and different perspectives, and who knows, maybe I'll learn something from you, maybe you'll learn something from me. I think that's a beautiful thing, and I'm afraid that we're getting further and further away. I mean, you look at the discourse, just I mean, politics. I mean, you can't have a conversation with anyone without someone wanting to, you know, cancel you or turn you off, and it's just silly, you know. We we get one life. Let's make it a beautiful one.
That's it. Honestly speaking, we just have to have the sense. And I used to say this very well. We have to continue to have the sense that we are in this life for the main time. We are not here for life. We are definitely here for the main time. It is just the way we have definitely live our life. That is how a lot of people will be role modeled or even really be impactful. Sharing this kind of kindness and also kind of empathy, and as you said earlier, having just this sign of community communication, one-on-one relationship. And I have to be honest with you, Mr. Brian, I'm a very young guy. It is not easy. I have to be honest with you. Having this phone time and everything is not easy. It's a very huge pressure. I just have to try my best. It's fate, and it's definitely something that I hope that I experience before I leave. I don't think it will happen, but we definitely hope for the best in the coming future, because we do lack a lot of people who are self-centered due to this type of technology that we have, and it's really affecting. I do not know how it's going to help us in a very long term. I do not know how it will go, but we definitely hope for the best, as I said it, honestly speaking, because we just have to see how everything plays out. I also want to sincerely thank you, Mr. Brian, for the opportunity and the time on speaking on this important. It's a very important conversation, and showing kindness and empathy could be one of the way. So also show this kind of encouragement to help them heal them and also help themselves in a way they could eradicate this drug use easily. I want to sincerely thank you on speaking on this topic. Thank you so much, Mr. Brian.
Thank you as well. I appreciate the time. Thank you.
All right. Have a wonderful day, Mr. Brian. Bye bye.
All right, take care. Thanks.